Thank you, Minister. Really just a huge thank you from me. I do want to reflect again on all of those people who've stepped up to get tested over recent weeks, really through the whole of this pandemic. It will be our protection going forward. It is super critical over the next couple of weeks. To have 25,000 tests a day, absolutely fantastic. I would continue to encourage anyone at that first sign of symptoms, no matter how mild, to come forward and get tested. We have found cases in the community that we would not have otherwise found because people stepped up to get tested. Obviously, we've got primary close contacts who are going through testing and we're following up those test results. But for anyone, and there might be people who are still undetected as cases in the community, if you get tested, we can drive this back down to zero. So just a huge thank you from me for those individuals. And then in particular, everyone who's made a sacrifice through this period of lockdown. It is an awfully painful period. I've always had in mind that we need to do what's required to make sure that we get back down to zero. There is really no alternative. Our national strategy of aggressive suppression is there for a reason. If you don't get to zero, there's no grumbling along with one or two cases. This started with one case in Wallet that has led to almost 100 cases over a period of a few weeks. So we absolutely have to drive back down to zero. That's been the national strategy for a reason. It's what allows our travel bubble. It's what allows our internal borders to be open again. And we don't want that pain for our border communities. We don't want the pain of struggling with ongoing cases that just continue to pressure us and put at risk a giant epidemic until we've got that vaccination coverage. And so again, to see all of those people who are quarantining as primary close contacts in their thousands, a huge sacrifice. It is no easy task, and so a huge thank you to them. And then just for everyone, it is not an easy period. We're still not back to normal. We do have some days to go, but again, with the minimum safe restrictions in place, that is really to make sure that we can continue to drive cases down, but to do so with the stepping out that allows us to start to live a more normal life. It remains a sacrifice. Kids home from school is bloody hard. As a parent of three in primary school, it's been hard enough for me, but there are many people who've done it so much harder as they juggle work or juggle being at home and with all of the trials and tribulations and traumas that are associated. So I just want to recognise that for every Victorian, but happy to take questions.
I want to ask you about continual closure of gyms. What's the medical advice?
Sorry?
What is the medical advice supporting the continual closure of gyms in Melbourne?
The continual
closure of gyms in Melbourne.
Gyms are a high-risk environment. I understand, again, the pain for those gym owners. We've had significant outbreaks in gyms through the second wave in Victoria. I think we had 27 cases in a gym. And international experience suggests that even when you've got high levels of testing, including for some gyms where they test people before they come into the gym, that the combination of indoor settings, closed environments, people exerting themselves, really has significant opportunity for spread. I don't expect gyms to be closed for a long time from now on. I am asking gyms to make that sacrifice for a further week as we can assess the epidemiology over the coming week. And of course, there's that support package in recognition of that.
But have you looked at gyms and worked out that there's absolutely nothing that can be done under the strictest circumstances to allow them to operate? There's nothing at all?
Look, of course there are things that help to mitigate risk, but at this juncture, closure is the appropriate measure. That's the view of the public health team that's advising Alan Cheng and myself. It's our collective view. As we open gyms again, they know to do all the things that we ask of them. Of course, they're fastidious about surface disinfection, but it is that aerosol spread when you're exerting yourself that's very hard to mitigate unless you've got an open-air gym. To the extent that people can exercise at the moment outdoors, and it's not a pleasant week for that, and I recognise that, but that is the safest thing to do. It is 20 times safer to be outdoors in gatherings than it is indoors.
Did you at all consider reopening gyms with density limits?
Talk us through how the 25-kilometre limit came into place. What's the public health advice behind that specific figure, and will you release that public health advice?
Look, it's really, as it's been right through, the constraint on the distance that you can travel limits the potential for contact with people across Melbourne. We've restricted travel into regional Victoria for the same reason, and we've seen that play out with ongoing protection of regional Victoria. It is the same kind of principle across metropolitan Melbourne. If you have the full freedom of movement across Metro Melbourne, and we've seen, at its peak, hundreds of exposure sites, people move for essential work enough. If you have everyone moving without constraint, then those exposure sites, the ability to transmit across the whole of metropolitan Melbourne increases.
Are there any cases among the current outbreaks that would actually have been prevented by a 25-kilometre travel limit, bearing in mind that people would still have been going to work and leaving home for the 4 reasons?
Look, I imagine so. The dilemma, as I've often referred to in public health, we don't know exactly what might have been prevented, but I expect...
In most cases, you know what the exposure sites were, though. Are you aware of any exposure sites where people were further than 25 k's from home for reasons other than the 4 reasons and transmitted the virus?
No, but we know that people have been to exposure sites and picked up the virus. If they had travelled from further away, then the potential for spread even further from those exposure sites would have been greater. There's no question about that.
For the first couple of weeks of these 2 clusters, though, people were free to move around.
Yeah, that's right. But we know that people can pick it up at exposure sites through contact with cases who are there. And so the further that they can move, the greater the opportunity there is for spread across Melbourne.
Pretty minimal easing, Professor. A lot of businesses probably won't be economic under the current caps. You can't visit someone in their home. We've got a lot of people in quarantine, a lot of primary, secondary, third ring contacts. I'm wondering what parts of the outbreak you're most concerned about for undetected spread. Where do you believe there are people not in quarantine who should be, who would spread it if we were to open up fully today?
Well, if I knew where they were, we wouldn't be worried about them. It's potentially undetected cases out there, and we've had a few mystery cases over the last couple of weeks, as recently as a week or so ago. So it is needing to have that high level of testing in coming days to be absolutely sure that there are no undetected chains of transmission. The Delta variant is one in particular that's obviously been discovered through people coming forward for testing that doesn't have that intermediary case necessarily with hotel quarantine that I would want to be absolutely sure that we can find if there are any cases. But also with the other variant, the Kappa variant, we've had a number of cases where acquisition isn't absolutely clear. So we just need to run that down as much as possible. And that means testing, especially across Metro Melbourne.
It's particularly that missing link from May 8 to May 25. That's what you're most concerned about?
No, that's not the greatest concern. It really is anyone who's out there at the moment with symptoms who's not getting tested, who could be a case. So, 25,000 people testing, absolutely fantastic. There'll be other people with mild symptoms. I just encourage them to also come forward and get tested at the earliest, because that'll identify them, they'll isolate their close contacts or quarantine, you run everything down.
So are you thinking that testing...
If everything goes to plan, when do you think that we'll snap back to where we were a few months ago in that COVID normal?
It is a week-by-week prospect. As the Acting Premier has flagged, we are looking aspirationally to the kind of levels that regional Victoria are moving to now in a further week. That would be my hope. But we've been surprised on a day-by-day basis around what can emerge, and we have to recognise that it remains a reasonably volatile situation. The idea of a snapback to absolutely no restrictions whatsoever, no one's done that after significant community transmission. It didn't happen after Avalon, it hasn't happened after other significant community outbreaks, and so we have to move by increments safely, but with the minimum restrictions that we know will continue to control this.
Are we talking weeks or months?
If down to 0 cases like this week, would there be any prospect of easing restrictions earlier?
We will assess on a day-by-day basis.
Can I ask the Acting Premier just a quick question if I can? You've announced an extra payment, that $2,000.
Again, the international and Wave 2 experience in Victoria shows that weddings have been a source of significant transmission, and they do remain a risk of clusters occurring there. There is close interaction at weddings for human behavioural reasons that are entirely understandable, but that constraint needs to be in place with those considerations in mind. It's tough for anyone who's planned a wedding. There are people who've cancelled multiple times because we never know how new cases might emerge. So, it's an awfully tough thing to cop, but unlike a funeral, it can be deferred to another time potentially. And that's not to say it's not hugely disruptive or expensive for people to have to change those plans. But we know that the close interaction and the way that you would want to celebrate a wedding makes it a not insignificant risk of transmission in those events.
So why the discrepancy between numbers for weddings and funerals? Is weddings particularly more risky? What's the medical advice?
No, look, they both have their risks, but you can't defer a funeral. They need to take place, and so we recognise that. We are trying to say wait a little bit, and your wedding could have substantially different numbers in just a short period
That's
of time.
not a medical decision.
No, that's a recognition that the risk, the imperative of a wedding is not the same as it is for people who are needing to attend a funeral.
How are the investigations into the how are the investigations into the Delta leak going, and how much importance do you place on the door opening incident that Emma Cassar discussed yesterday afternoon?
Oh, it's ongoing. It's really for CQV to come back on the details of that. We're doing our bit as health to look into any potential historical cases that might be intermediaries, but nothing's turned up thus far.
In April, when you and Emma were attending the Novotel on a number of occasions to see if it was up to scratch, and it wasn't, and the managers were sacked, of the 51 breaches during its first 4 weeks of operations,
I can stop you there. That's going to be for Emma Cassar. I can't speak
You don't
to
know what the
CQV's
breaches were?
operations, no.
You visited though, what did you see anything, and as a consequence of these breaches being noticed, there were people who lost their jobs. Did you see anything at that time?
So
that
I didn't see it
concerned
during
you?
an operational period. I saw it in terms of the plans and the setup and the infrastructure, and it looked fantastic. But that's a very different picture to the various challenges of operationalising it and running it over time.
Emma said yesterday that there have been offers to the residents who live in the neighbouring apartment building to meet with them. Those residents aren't aware of any of those offers being made to them directly, and in fact letters from their lawyers have been ignored. Should CQV and the health department approach and these people more directly, and I guess from a point of view of working out what the problems are, actually talk to them directly and see what their problems are from their point of view?
Yeah, look, that's for CQV to answer.
Chief Health Officer, Sky News has seen CCTV of an incident where, at this hotel that we're talking about, the Novotel
Sorry,
Ibis.
if you've got questions about hotel quarantine, they're really not for me to answer. It's for the Commissioner.
So is no one here able to answer the questions?
Sorry?
Is no one here able to answer questions?
Well, no one here is the Commissioner for hotel
Right.
quarantine.
Would we be able to speak to her at some stage? Because we have questions.
There's your answer, yes.
Can I ask you on the staging of the Delta variant, has anything changed in the last 24 hours? Are you still looking at the airport as being one of the most likely scenarios?
I don't know that there's a most likely scenario. We have to look at every possibility. We're running down all contacts at the airport, nothing of concern. The individual involved had exemplary behaviour from an infection prevention and control point of view coming off the plane and through the airport. There's been some testing of the staff who were directly interacting. Nothing's turned up. We'll continue to look at that. The transport from the airport again looks perfectly okay. But something's happened and we need to try and get to that as much as possible, not just to see if there are close contacts that we need to run down now, but for any lessons around finding those gaps and those tiny improvements that might be made into the future.
How long do you think it's going to take for us to get back to those restrictions we had before this outbreak?
I hope it's as soon as possible. The The last few days have been terrific in as much as the new cases that have emerged have been people who are in quarantine at the time that they're diagnosed and for their entire infectious period. That really means there's no additional exposure sites, so no more primary close contacts to chase down, no more people at risk of transmission, and no more unexpected cases that might turn up over the next couple of weeks. So that's all very encouraging. And if you've got a couple of weeks like that, you can be extremely confident, but not absolutely and unequivocally guaranteed that you can go to a very substantial change.
So if this trend continues, do you imagine Melbourne will move to what regional Victoria is this time next week?
That's an aspiration, absolutely.
Chief Health Officer, just on the hotel, I'm just wondering if you could answer this one. So have we followed up on the 2 people on the same floor as the infected man at the Novotel who didn't get their day 17 and 20 tests?
Yeah, we're following up all of those. I don't have a response on the specifics of CQV's investigations at the moment.
Okay, so we don't yet know whether they have been tested or we don't know the results?
I can't speak to it. Yeah.
Okay, and also between the end of October and June, Victoria has had the highest rate of hotel quarantine breaches per case of any other state, with 1 in every 42 cases of breach. Why is this?
We have had fewer breaches than some other jurisdictions with respect to hotel quarantine. We need to look at what the causes are, but as the Acting Premier said, as every First Minister or Head of Quarantine or Public Health across the country has said, we need to look at every single aspect, every mitigation in hotel quarantine, because they are not, from an engineering point of view, the most ideal. They're not open air, and so there are issues with ventilation that must be addressed. There are issues of PPE that must be addressed. All of the tracking of staff, the testing of staff, all of those things are in place in Victoria, but that doesn't make it a zero risk proposition, and we just need to continue to understand what's happening with this virus and to see if there's anything else that can be put into place.
But do you have ongoing confidence in hotel quarantine in Victoria?
Yeah, absolutely. Again, it doesn't mean that we should never consider that there isn't a risk of the virus coming out of hotel quarantine. Again, we see that lesson again and again from across Australia, and we should always look to improvements or alternative quarantine arrangements that can change that risk profile. But again, that's why the call out for testing for anyone, even when we've got no transmission across the country, is that we just never know. And so the risk of transmission back into the community will remain, and people who've got symptoms need to be aware of that and bear it in mind when they have a cold and think it can't be COVID, but indeed it can be for those rare occasions.
Has any consideration been given of stopping flights returning to Melbourne, given this lockdown has been extended because of this outbreak in West Melbourne, which is a result of hotel quarantine?
Look, it's always under consideration, but the operations are separate and different, and the advice from the Commissioner, Emma Cassar, is that hotel quarantine arrangements can continue and they are within capacity and capability.
Chief Health Officer, we've put in place a lot of measures to improve our hotel quarantine system since the second wave, but the most recent figures that I just mentioned show that we still have the biggest issue of any state. Can you tell us why that is?
I don't know that we have the biggest issue of any state. As I said, we haven't had the most number of breaches from hotel quarantine.
That's because we've had fewer positive cases, though. The statistics that
Yeah,
Julie's
we don't
talking about
know.
relate to the number of positive
This
cases.
is per positive case, with 1 in every 42 positive cases of breach.
Yep.
So that is the highest rate of any state per cases. Do you
Sure.
have any idea why that is? These are recent figures.
Sure. Look, hotel quarantine is not a perfect system. It is still, and Paul Kelly's, I think, referred to this in estimates, it is still probably the most powerful and positive public health intervention that Australia could have made back in March last year. It has gotten us to that state of no community transmission that has made a world of difference on the global scale in terms of how we've managed to open up in Australia and how we've managed to protect so many Australians from long COVID, from dying. There will be ongoing challenges with hotel quarantine. We just need to continue to investigate and improve as much as possible, and where alternatives that can be built exist, we should pursue those as
Just
well.
on alternatives, I know it was rejected after the code inquiry. When do you think it could be safe for home quarantine to become part of the mix?
It's very hard to say. That's part of a national conversation, and AHPPC are contributing to that. But it is not at the moment seen to be anywhere near as safe as full formal quarantine within a hotel system, despite those inherent risks in hotel quarantine. Being vaccinated, 70-80% protection from transmitting to other people. That's not the same as the very, very high levels of containment that occur for the great majority of people in formal quarantine.
On vaccination, there's been a passport or a vaccine pass announced by the federal government today. Does that in any way, shape or form have a practical impact for Victorians who've had their jabs fully inoculated in terms of these restrictions or future restrictions?
Yeah, look, I haven't seen the details of it. I'd have to check. Does it relate to international travel or does it relate to domestic?
No, it's just like a vaccine passport.
Yeah, look, it's a useful thing to be able to have that documentation, understanding that these are documents that have been forged internationally. These are these become a potential currency for people with the freedoms that might be associated with them. So there's a lot of thinking through in terms of what it means for movement or whether or not people might be subject to restrictions in the same way.
So you don't have any confidence that the MyGov app would stop that forgery?
Look, I don't have the details. I haven't seen this announcement, but I think there are lots of complexities that will continue to need to be explored in relation to them.
Will we see crowds at major events, for example, a footy in a couple of weeks' time? What's your sort of timeline on that?
Yeah, I'll take advice from the Public Health Assessment Panel in relation to public events. They've always been really thorough in their review, and I think they've always been fair in what they've allowed to occur. But I haven't seen any formal advice come through yet, so we'll just need to see that play out.
What about
on the
elective
lockdown.
surgery? When is it resumed?
Look, that's a call for the State Controller, Ewan Wallace, as Secretary of the Department, but that's under consideration all the time.
So has
that from
decision
your health
hasn't been
advice?
made yet? Or-
Not that I'm aware of. At the moment, I think it's restricted in metropolitan Melbourne. It's going ahead in regional Victoria. But there are, of course, those emergency and higher category elective cases that go ahead.
So,
We've
Professor,
seen
there's
a huge
there's no
lag
health advice at
effect
the moment.
from last year as a consequence of the lockdown in terms of the wider health system. Are you worried that the pause we've just had might exacerbate that further?
Oh, of course, any disruption that defers people in terms of some of the care they get is hugely unfortunate. My role is to provide public health advice to make sure we get through it as fast as possible and as safely as possible so that we're not dealing with either another surge in cases or grumbling cases that put us at risk ongoing.
Sorry, just on elective surgery and maybe aged care as well, but elective surgery first. You said this is a decision for Ewan Wallace,
Yes.
but Minister Foley has previously said it's based on health advice and the moving around of people. So what is the advice at the moment from you for elective surgery to be halted?
So health advice is across the board. It relates to the commissioning and service improvement area of the Department of Health. Ewan Wallace, as the Secretary, takes my advice, takes broader advice for the division that oversees acute care. So it's a broad suite of inputs for the State Controller to decide upon.
Just back on the lockdown, you said...
Just before you do that, let's Martin question.
So in terms of bringing the lockdown forward, I mean, why can't we do that now?
We've needed to see how the cases have emerged over the last few days in order to have that level of confidence. You can't flip a coin and say, I hope, with a 50-50 chance that we can get control of this. The prospect of ongoing transmission, the prospect of a return of an epidemic of either the Kappa variant or the Delta variant is pretty awful. We are looking to snuff it out completely. We have to take that path, and so you have to have sufficient confidence that the measures in place and the timing of easing of them do that. And we've needed the last few days to see that new cases are emerging in people who are already in quarantine, no new mystery cases emerging. the number of primary close contacts decreasing by hundreds as it has each day, and indeed the number of exposure sites now down to 160 odd. Those are the things that give my team the confidence that this is the appropriate time to make those changes. But it's not a case of flipping a coin and hoping for the best.
So I guess I meant in terms of waiting until midnight tomorrow, why can't we just start at midnight tonight?
So there's complex legal drafting to be done. That needs to be measured against all of the charter considerations for each and every charter obligation that is in play with restrictions, and to make sure that it's not a sloppy process. We have to go through with a fine-tooth comb to make sure that every single drafted piece with the public health directions are appropriate and correct.
What's the, you're talking about public health advice, what's the advice that allows in regional Victoria 100 people to go to a brothel on one day, but you can only have 2 visitors to your home?
So visitors to the home are a particular cumulative risk. We're talking about hundreds of thousands, millions of homes across Victoria. When you have a particular easing of a restriction for an indoor environment, the most high-risk environment indeed for transmission for coronavirus, you have to look at the cumulative effect of what it means to allow 2 people plus dependents, excluding kids under 12 months, across those hundreds of thousands of homes. For other venues, you are also looking at the cumulative risk, and if there are only 3 or 4 of those venues, if there's no casinos, if there's a few other settings that you're talking about easing restrictions, the cumulative risk is not the same as what it means to change the settings for a private gathering. Of course, if you're just looking my home versus what I'm able to do in another particular setting, it looks out of accord, but we have to look at what it means to make those changes across the board, understanding what it means for millions and millions of person-to-person interactions.
What are the factors that would trigger another lockdown?
Sorry?
What are the factors that would trigger another lockdown?
The same thing as I've said every single time.
Are you concerned that we're going to see mystery cases in the next few days, and if we do,
No, I don't think so. I think every day that goes by with high testing numbers, and again, if we can get 25,000 plus tested every single day, that would be terrific. And if those test results are coming back negative for all of those cases, that would be very encouraging.
Professor Sutton, we've already heard about restrictions easing in Melbourne next Thursday, hopefully.
Yep.
Will restrictions also ease for regional Victoria? Will we still have that difference, even though we're allowed to travel between the two
Look,
areas?
I hope so. We need to see what the week ahead has for us.
And just on community sport in regional areas, are they allowed to have crowds, or does that 20-person gathering limit outdoors apply?
So there are public gathering limits, but for indoor, it's a case of a venue limit and a minimal required number for that competition to go ahead.
Outdoors, though, at local footy or the local netball in country areas, how many people are they allowed to have in a crowd?
I'd have to come back to you specifically. I think it's the outdoor gathering limit.
Last question, just on vaccinations, not sure if this is one for you or the Acting Premier. Will police receive priority? Some have been told to call the COVID hotline to make a booking.
Certainly they're in the 1B priority grouping, but I don't know if there's anything else to add in that regard. Police as a priority for vaccination.